you how to set up a sterile tray. We have a milligram tray that I'm going to show you. The first thing we want to do is we want to check the expiration date and make sure your tray is not expired. The expiration date on this tray is 11/30/2021. The next thing you'll want to do is make sure that there's no tears or breaks in the packaging. So you'll want to look over the whole tray and make sure it's not open or broken. You want to gather your supplies. You need sterile gloves, and then you need anything you're going to add to the tray, which is, for this, is needles. You'll want to wash your hands. So you'll wash them with soap and water. Make sure your hands are clean. I like to wear a mask. That way I'm not breathing all over the sterile tray. And then while we're opening the stuff, we'll want to wear gloves. We don't need sterile gloves whenever we're first opening the package because the outside is not sterile. So after I wash my hands, I'm going to put some gloves on. And then we can start opening our tray. I've inspected the package and it is intact, so now we can start opening. We're going to remove the outer wrapping, and you can take your tray out of the packaging. You'll want to turn your tray so you can open it correctly. We're going to start by flipping away from us. So we're going to open the first flap away, and then we can do the sides. You can touch the outer corners of the tray. It's not sterile. Make sure you don't touch anything on the inside. That is what is sterile. So you'll grab the last corner, pull it out. You don't want to lean over the tray as well because then it will not be sterile. Now that our tray is open, we want to make sure we maintain this sterile field. I am going to drop my needles in. You're going to open your package and make sure not to touch the needle. And then you will let it fall into the tray. Same thing with this needle. I'm going to pull it open, making sure I don't touch the actual needle, and let it fall in. So now we've added our extra supplies to the tray, and I'm going to take my non-sterile gloves off, and I'm going to put my sterile gloves on. I'm going to show you how to properly put on sterile gloves. You're going to open your package and remove the gloves. I'm going to open this up, and you can touch the corners of the package because those are not sterile. You don't want to touch the inside of the packaging or the outside of the gloves. You'll slide your fingers under these two folds and you'll open up your package. I'm going to put my right glove on first because I'm right-handed. So I'm going to grab the outside fold of this glove where it's not sterile, and I'm gonna slide my hand in, making sure not to touch the outside of the gloves. I'm gonna grab this part that touches my skin and pull it down. And now I have one sterile glove on. For the next one, I don't want to touch the outside. I don't want to touch this inside fold of the glove because it's not sterile. I want to touch the sterile outside part of the glove. So I'm going to slide my fingers under this fold. I'm going to slide 2 fingers under that fold because that is the sterile area. And I'm going to slide my hand in the inside of this glove. And my fingers are not in the right holes, but that's okay. I can fix it with my sterile glove touching the sterile part of this glove, and then I can pull it down. And now I put on my sterile. Now that I have my sterile gloves on, I can touch the inside of the sterile tray. I'm going to set the tray up in preference of what the doctor likes. So I'll take my cover and my drape, and I'm just going to set it to the side over here, making sure it doesn't touch anything that's not sterile. I have my lidocaine. I'm going to check the expiration date, and it says December 2021. I can set it up here. I'm going to move all my needles into the slots that is for needles. I can throw this paper to the side, still making sure that we don't touch anything that's not sterile. We're just going to organize your tray. We have our Band-Aid. We have our tubing that we can open and stretch out, get the kinks out of the tubing. Going to use the pink needle to draw up our lidocaine. This needle has a filter in it, and since we're using a glass vial, this will filter out any shards of glass that might accidentally be in there. So I'm going to put my needle onto my syringe. I'm going to break the top of this lidocaine. You want to face away from you, put your thumb on the line, and just pop it out. This lidocaine has a little bubble in it, little glass bubble, so you can tip it over and it won't spill. You're going to remove the cap of the needle, and you're going to draw up your lidocaine. Put the glass vial back in its place. You can recap this needle by not touching it, and then you can remove this needle because we're not going to use it. We'll put on our little 25 gauge needle, and that's what the doctor will use to put the lidocaine in the patient. We'll just set this to the side. After you're done setting up your tray, you'll want to cover it back up. You can use this drape to cover it. Make sure it doesn't touch anything that's not sterile. And you'll fold this over your tray. And that is how you set up a sterile tray.